So in my practice in working with women and what my team is doing in terms of sort of one-to-one support with women, there's a lot of focus on the cognitive aspect. So people hear this buzzword, cognitive behavioral therapy and CBT, and we get lots of people who call and say, I need CBT. My doctor said I need CBT, and they're not really sure what that means. Mm-hmm. And, you know, we as therapists, we're pretty trained in providing sort of that cognitive therapy. Mm-hmm. But there has been more of a pull in the last probably 5 or more years to bring in some more body practices. Right. You know, I've taken some training. There's been lots of training offered in somatic work mm-hmm. and mindfulness-based stress reduction mm-hmm. and lots of, I would probably call them like the new age words for ancient practices.
Exactly. That's exactly what they are.
Okay. Yeah. So I'm curious on, I mean, you and I have spoken about this before, but I'm just really curious on your thoughts based on the work that you do. Mm-hmm. You know, what I'm seeing is that we can get so far with working with the mind and meeting people at that cognitive level and mm-hmm. talking about our thoughts and our feelings or the body reactions mm-hmm, that happen. Mm-hmm. But then there seems to be, again, we mentioned like this disconnect from how to get into your body and really recognize what's going on and work with that. But I'm just curious how, you know, the work that you're doing, how that might support women who are feeling mm-hmm. a bit stuck in their heads.
Yeah, the beautiful question. You see that when you're even explaining this question, you're saying about mind and body. Mm-hmm. Right. We are not taking into consideration consciousness. Yeah. Now, what you're referring as a mind is predominantly the sensorial mind. Sensorial mind, at first place, gave birth to the challenges. Right. And I'm exactly going back there to find a solution. Mm. Definitely, we can reprogram the sensorial mind, manas, how we call it in yoga, to an extent to realign our outlook at life, and we can reprogram it. But most of our behavior is originating at the deeper level of psyche. Right. We are expressing traumas. We are expressing what the deeper archetypal wisdom trying to manifest through us. Right. So we need to return to that. And then the mind-body practice, of course, yoga is predominantly a somatic work when you're referring to hatha yoga and the asana, mm-hmm. but it's not only limited to the somatic dimension. Now, here we are taking one more step further and we bring the component of energetics. Mm. How am I awakening tapping into the different chakras, different energy centers, and how can I keep them in an optimal functional state so that they can be a fantastic bridge between the visible and the invisible dimension of myself. Yes. So my behavior is just it's the surface reality. Right. I want to go at the deeper, try to identify what's the cause, and we want to bring a transformation at that level so that the manifestation, the outcome will be different. So I behave differently. Mm-hmm. You know, as I change the deeper inner programming.
I love that. And when you speak about it, it seems like that would be the easier route, right? Because it's like it's a simple route, but we're so detached from that experience, I think, as humans now, that it feels so difficult mm-hmm. to go back. Right. And I notice a lot of resistance with many of my clients when we talk about that approach.
Yeah. We don't feel safe anymore to return back to our body. Yeah. So this, COVID is not pandemic. These other health conditions, these are not pandemic. Maybe the true pandemic thing that we are experiencing is this homelessness. Mm. We are so disconnected from ourselves. Yeah. We need to find a modality, create a bridge. So step by step, we can return back to ourselves. Mm-hmm. And not through self-criticism, not trying to fit in a so-called life thing, but returning back to our authentic self. Mm-hmm. Yeah? Remembering, it's there.
Yes.
Anyways, there. Remembering
Yes.
our authentic self.
Yeah. And I'll often say to clients, you know, the process of remembering your authentic self comes from like turning off your busy brain, right? Like finding the strategies to just turn off all of the thoughts. And when I tell people that 80% of the thoughts that we have are actually unconscious,
exactly,
right? We only are in control of like 15%, or less. Really, it can feel shocking to them because they feel like, how can I be having any more thoughts? Like, so how are these subconscious thoughts even happening when I have so many conscious thoughts that are keeping me so busy and distracted all the time?
Exactly. And these unconscious thoughts are the puppeteers, and we are like the puppets, right?
Right.
That is controlling us.
Yeah.
And then when we want to manage, we are going and bringing in a therapeutic setup or trying to work in my own contemplative practice only with the conscious thought.
Right.
So,
we can only go so far. Right.
Yeah, that creates the limit, and then we hit the ceiling.
Yeah.
We cannot go past that.
Absolutely.
So, if you will ask me the question now, where I sense and see how the therapy should work or could work actually, will be talk therapy is excellent. But as a therapist, we need to learn to read between the lines, to read what the body is telling you, not only what he or she is, the patient is telling you, the speaking, you know. That's one. And then when in a non-confronting with a non-confronting attitude, with a lot of love and care, invite them to body-centric presence. Inviting them just to stay with your body, see what is coming to the surface. And I do believe people have that inherent wisdom that if you can bring somebody close to themselves, they know already what needs to be done.
I totally agree.
Right?
Yeah.
We don't have to give a recipe for well-being. The recipe will come from within.
And it can feel scary. And I'll have clients say, like, I don't want to feel this right now. And I think the hardest and the most valuable therapeutic work is like just sitting and witnessing and being with whatever is happening and coming up, versus
to sit with it, right?
Yeah, versus like offering a strategy to get out.
Yeah, this is another challenge, because you see, though, with the social media becoming a source of our learning platform, replacing the learning platform, everybody is offering a 15-second solution. You do these 3 things and life will be different.
You set boundaries. It's all about you just set boundaries with everybody in your life, right?
Exactly. I doubt if that's going to happen. No, the learning, some of the learning thing is a painful, time-consuming process.
Yes. Yeah.
No?
Absolutely. And I think, I mean, we could talk about social media for hours and hours and hours, but the impact, and I will often say that to women, if you can just change your algorithm, that will help you immensely, because the impact of looking at one video or hearing one perspective of, this is the one thing that will change your life, it's so harmful. So
anybody listening to this talk, and anybody from an IT background, they should think very clearly, can they become an IT therapist, step into somebody's life and change their algorithm. Now they will have a different news feed.
Yes.
If we can do that.
Just dogs. I say watch dogs.
Yeah, watch dogs. That will do great stuff, right?
Cute puppies.
Yeah.
No, I love that. And that's been a big shift in our practice is how do we move past the cognitive approach, even though that's the most prescribed and the most well-known and most often talked about everywhere. Doctors will refer their patients and they'll say, like, they need CBT. Meanwhile, doctors don't necessarily know what that means or what the patient might need therapeutically. And that has been a big shift in our practice, is how do we actually just show up and meet you where you're at and help you to sit with what you're feeling, or learn to listen and find your intuition or your inner voice, because it's been so lost. And when we ignore something for so long, or we're conditioned to not trust it and not listen, it feels like it's completely gone.
Right. There has to be an ongoing re-educating process it will take time for somebody to learn how to trust themselves, trust and their inner voice. Some are even confused. What they hear within is not their inner voice, and that can be a truth, actually. So what you said earlier, that the mind should become calm to an extent before we can engage to that inner dialogue, will be essential. And actually that brings, if we collaborate in doing something, that will be my part. I'll not going to invite them to listen to what's happening in your head. Come and work with your body, listen what your body is telling you. Now that the energy circulation in your body is different, now you can go back to the therapy and listen now. You will be listening completely different things.
Yeah, absolutely. Absolutely. No, I love that. And I think it is the combination too, right? Because if I give people homework around to go and pay attention to what you're telling yourself, like what your thoughts are, and also bring in a 20-minute practice where you're, listening to a guided meditation or just sitting with yourself, because that's a challenge for lots. I say 5 minutes, and people say I can't do that. Sit in silence.
Initially, a lot of hand-holding is essential for them to remain in their own presence. Because the critical mind gets activated, and you'll say, "Oh, I'm not good enough. I'm like this, and I don't like my body. I'm too fat. I'm too skinny. I'm like this."
Not enough.
Not enough. Yeah, exactly.
Yeah.